Royal College style question. Which of the following statements best describes the role of TGF-beta in proliferative vitreoretinopathy? So TGF-beta is not detected in the vitreous of PVR patients and has no role in membrane contraction. Option B, TGF-beta stimulates the transdifferentiation of retinal pigment epithelial cells into myofibroblasts and the cascade of events that we just explained. Or option C, TGF-beta exclusively inhibits extracellular matrix production in the retina. Or D, TGF-beta lower in eyes with intraocular fibrosis compared to uncomplicated retinal detachments. Or E, TGF-beta signaling is only relevant to vascular, not fibrotic retinal disorders. So once a wise man said the option with too many details, the biggest option is the correct one. So as we just mentioned, TGF-beta, transforming growth factor beta, is very important for the healing and fibrosis process. Even in keratoplasty, in deep anterior lamellar keratoplasty, penetrating keratoplasty, TGF-beta is very important. Healing of the corneal section after extracapsular cataract extraction or after phacoemulsification involves TGF-beta. Formation of corneal haze following LASIK and LISIK involves TGF-beta. So TGF-beta subtype 1 is usually present in the anterior part of the eye. Subtype 2 is usually present in the vitreous and in the posterior part of the eye. So TGF-beta is usually detected normally in the vitreous, and it's detected in higher concentration in cases with PVR, as we just explained. And this is the correct one, the correct option. Option C, TGF-beta inhibits extracellular matrix. This is wrong because it enhances extracellular matrix formation, and TGF-beta are lower in eyes with fibrosis. This is wrong because it's responsible for fibrosis and healing process. In fact, this question, the Royal College questions, has only 4 options. Here we have 5. The 5th option was important for me because we have 2 disorder pathways, the vascular pathway and the fibrotic pathway. So TGF-beta is only relevant to vascular, not fibrotic, but it enhances extracellular matrix, it enhances fibrosis and healing, and it involves vascular enhancement as well. So congenital anomalies involving TGF-beta in ophthalmology, it's involved in Peter anomaly, and some authors hypothesize an important TGF-beta to be an important factor in aqueous humor drainage and in primary open-angle glaucoma pathogenesis. For the vascular anomalies with TGF-beta involved, we have the Rendo-Weber-Osler syndrome, which is haemorrhagic-telangiectasia. Sorry, I don't like writing on PDF notes. I prefer Word for that. Anyhow, so TGF beta might be involved in vascular anomalies like haemorrhagic-telangiectasia syndrome. In haemorrhagic-telangiectasia syndrome, besides these cytokines, the TGF beta, we have the vascular endothelial growth factor. So I'm just saying that because just trying to let you know that there is a common pathway for PVR, for epiretinal membranes, for vascular anomalies like haemorrhagic telangiectasia.